So can you see my slide?
Yes, sir.
Okay, thank you. I must confess that the first problem that I had when I was given this topic was to try and decide which pioneers I was going to speak about. Because there are, after all, so many people who have shaped medicine as we know it today. And then as I looked at the other topics that are there for this lecture series, I realized that there would perhaps be many others who would talk about pioneers in the lectures that follow. And so I've chosen 4 people for today, intertwined with others as we go along. And I hope that these stories that I tell you will be as interesting to you as they were to me. I want to take you back in time to the French Revolution. This was a time that must have been absolutely terrifying for people who lived at that time. And my first story is about a young boy, not yet 10, who lived in the town of Nantes with his uncle, who was an eminent physician, together with his brother and a cousin. He had lost his mother when he was 5 years old. And he traveled to this town because his father didn't have very much to do with him. During this phase of the French Revolution, mobs ruled the streets and outside his home. And whenever the mobs gathered, the 3 boys would run to the basement. But it is estimated that this young boy would have seen at least 50 people guillotined. The person I'm talking about is René Théophile Laennec, a person whom we all will all remember as the person who invented the stethoscope. He was quite a remarkable person because he was not destined to do medicine. And but for the fact that his uncle saw in him that spark, that zest for not just learning, but for people, he went on to do medicine. He went on to win the prize in medicine and surgery, which was quite unusual at that time, and to get for one person to get the prize in both these disciplines. And then he went on to practice medicine. And this is where the stories sometimes may be embellished. They may not be exactly as they occurred, because we rely on sources and very often secondary sources. So it's believed that in September of 1816, René Théophile Laennec, then a 35-year-old French physician, observed 2 children who were playing a game where one child on a long piece of wood, one child scratched one end and the other child placed their ear at the other end of the wood. And if we've done this as we would have in our lives, we'd know that the sound is extremely loud and amplified. And therefore, armed with this knowledge, René Théophile Laennec goes back to his hospital, and he is confronted with a woman who is young with a cardiac condition, and she is well endowed. And René Théophile Laennec is a very shy man, and he at the practice at that time was for the physician to place their ear on the chest of the patient, and Théophile Laennec cannot do that. So, inspired by what he sees, he rolls a newspaper, places it against the chest of the woman, and is able to hear the sounds remarkably well. The stethoscope is born. You could wonder whether this was pure chance. And if it was chance, why didn't people think of it earlier? Did no one encounter such an event in their lives? Laennec went on to describe all that he did in this thesis, where he called this procedure mediate auscultation, where the cylinder, because he later on went to construct a stethoscope made of wood, was the mediator between the patient and the physician. When we think of his life, we often think of it as just Laennec, stethoscope. But Laennec did more than just roll a piece of paper and place it on a patient. If you look at the books that we read in clinical medicine and the descriptions of all these things, you will notice here that there are many words that we use, which were first used by Laennec himself as he described his findings on subsequent patients. And then he began to distinguish the clinical conditions that he encountered in the lung. The response to all this, you might imagine, was not unequivocal. As often happens with something that is new, some people were advocates for it, other people felt that this was just a silly affectation. Some people felt that the cylinder that he had developed was too short, others too long, and many people had difficulties hearing what Laennec had actually heard in the course of his investigations. But by 1820, this is what was said, that if this method, namely mediate auscultation, had a quarter of the utility attributed to it by its inventor, it would still be one of the most precious discoveries of medicine. The idea of listening to the chest is not new. And so in this Hippocratic corpus, you see this statement, "You shall know by this that the chest contains water and no pus. If in applying the ear during a certain time on the side, you perceive the noise like that of boiling vinegar." And so for me, the discovery of the stethoscope by Laennec is more than just the fact that he heard sounds. The fact that he tried to classify these sounds, the fact that he tried to allocate these sounds to different conditions, to classify disease and group diseases with similar findings, is what makes his discovery truly remarkable. In this slide on the left side, you will see an improved version of the roll of paper that he used. He now has a wooden cylinder, and attached to the wooden cylinder at one side is a bell which can be screwed on. And subsequently, about 40 years later, on the right panel, you can see that stethoscopes have now started making their mark, because they are now commercially available. And right in the center, if my cursor works, you can see that Laennec's stethoscope continues to exist 40 years after he developed it. The word stethoscope is derived from the Greek stethos, which means chest, and scopion, which is to explore. But the name didn't come easily. In fact, Laennec never used the word stethoscope. He preferred to just call it the cylinder. Another French called it the la bâton, solometer, coronet, médical, all sorts of names, but the stethoscope finally stuck. And if you look at the development of the stethoscope subsequently, you see that its evolution actually took a considerable amount of time. So in about 40 years after Laennec's initial invention, so to speak, you now begin to have the development of a binaural stethoscope with flexible tubing. And then it is over 100 years later that you actually have the combination of a bell and a diaphragm in the stethoscope as we know it today. The fact that the stethoscope becomes an essential part of the physician, apart from being a rite of passage for medical students as they shift from preclinical to clinical years, is seen in this remarkable photograph of William Osler examining a patient, possibly in Johns Hopkins, his stethoscope clearly in hand. And even today, I picked up this article published in 2003. We can see that nearly 200 years after the stethoscope was described, research is still being conducted on the utility of the stethoscope and the use of the bell versus the diaphragm. But Lennox's discovery must be placed in a larger context, and that is the development of this remarkable French school of medicine, which at the center of which was this man Vaz. The French school was predicated on these three major points. The first, that they would identify ways in which groups of symptoms were consistently shown to occur in specific diseases. And then, as was the practice at that time, they would attribute these symptoms to some anatomical changes. And they would try and find out which organ was involved and what were the changes that were seen in that organ. This was something that was rampant throughout Europe. Anatomy had developed far ahead of physiology and biochemistry, and the conduct of clinical autopsies was something that was fairly routine. We know this in the lives of other pioneers, Ignaz Semmelweis, for instance, who propagated the practice of hand washing. In his story, we learn that doctors went from ward to the morgue, examined the corpses and bodies of patients who had died, and in the process transmitted their infections back to the ward, causing what was then called the doctor's plague, which was really puerperal fever. But in addition to these two things, there was a third element which I consider very important. And the French School of Medicine wished to find ways that in addition to symptoms, signs could be added on by careful examination. The stethoscope is part of that development. But also part of that development is what Vaz publicized, and that was the idea of percussion. Leopold Auenbrugger, who was a son of an innkeeper, had described a percussion where you place the finger and you tap it against the chest and elicit the sounds from a chest which is either filled with air or fluid or solid. And although this book was written, it never ever really became popular. And Vaz, 50 years later, brings this book, and many people suggest that he could have taken credit for percussion, but he didn't. He actually attributed it to its original author, but that too became part of this third objective of the French school. Here's a picture of Laennec. And while we think of him in relation to the stethoscope, he was truly a giant despite his diminutive size. He was responsible for the nomenclature changing from phthisis, which was wasting and decay, to tuberculosis, because in his role as physician during his autopsies, he identified the tubercles that characterized tuberculosis in various options. He also described peritonitis and its consequences, the presence of adhesions and false membranes, of intra-abdominal fluid. He noted the brown color of the liver in cirrhotic patients. Well, they didn't use the word cirrhosis at that time, but he used the word kiros to describe the tawny color of the liver in cirrhotic patients, and that went on to the term that we use today, which is cirrhosis. And he also showed the existence of pigmented tumors, which we now know as melanomas. So, like many people, we tend to associate a single event or a single discovery. And Laennec's life shows us that the life of a pioneer is often much more than their primary discovery. And if you're a person like me who actually learns the history of medicine not only from words but from pictures, you may well have seen this picture, which is part of a series on the history of medicine. This was a picture that was developed by the artist Tom for a pharmaceutical company in the 1950s. And the picture on the right shows you Lenek examining a young boy, the mother there. I must confess, when I see this picture, it doesn't do much to me. It doesn't tell me anything about the times of the person. And very recently, I uncovered the picture on the left, which is a sketch by a German artist. And I could not help but see the similarities in these two pictures, and yet the remarkable differences. The picture by Thom is almost unreal. The boy seems fairly healthy. The mother it does not show concern, although she, as a mother, she would obviously be concerned about, but she seems more or less comfortable with the knowledge that the physician is examining a child. Well, look at it on the left. The child seems a little more emaciated. The worry is writ on this mother's face as she looks down. This is the picture that René Théophile Lenek would have encountered as he examined patients. And for me, it is best exemplified in this alternative painting by Chartrand in 1816, where he shows Lenek in very muted colors. You can see the patient emaciated with almost the face of death. Lenek holds his ear, but also a stethoscope. And look at everyone else. The nurses, the other attendings in the hospital stand back. The nurse has a stool in front of her, almost as a barrier, because this is the white plague, tuberculosis. The very diagnosis is death itself. And looking at this picture, we could ask so many questions. What do the muted colors represent? Do they represent the depression that is associated with this picture? Does it represent the inevitable death? And in this picture, you have the students taking note right by the side of the nurses, but far away from the patient. Lenek is close to the patient, and in this, he becomes the focus of this painting. So it does not detract from his primary role as the discoverer of the stethoscope. This is truly, for me, the way in which history of medicine reveals the events in so many ways. And it could be interpreted in so many ways. It calls us to ask ourselves, where does the duty to care lie for physicians? What is social death, where the patient is dead already because society does not want him? Society does not shuns her. It's something that would be repeated with the advent of the HIV/AIDS pandemic in its start. When Lenek was about to die, and he dies of tuberculosis, having lost his mother and his brother to tuberculosis, his final paragraph, which he writes in his will, is to his nephew, where he says, "I give him my watch, my ring, and above all my stethoscope, which is the best part of my legacy." We may remember Lenek for the stethoscope, but I think there are a lot more that we can remember him for as well. I'm going to move on to another aspect, which is about digestion. And I have this quote which William Osler writes about regarding a 17th century predecessor in Oxford. I must confess that when I looked at this, I couldn't help thinking it would be wonderful to read it like a pirate in the Pirates of the Caribbean. There are so many of these things. Ye first tincture from ye spittle, and going through ye esophagus is imbued with ye same, till in ye fundus of ye stomach it lies in the liquor of ye same nature but greater activity. But what is really remarkable about this description is how much was deduced from so little, actually, because this was a phase when physiology and chemistry really hadn't developed to any large extent. And so my second pioneer, I took across the Atlantic from France to the Americas, a relatively new colony, to a fort called Fort McKinnock in Michigan. These are pictures of the fort. Boats used to come up. It was a fur trading center. And so traders used to come with the furs that they had caught, that they had collected over the winter, and trade them here under the protection of the armed forces. This fort changed hands from the French to the Americans, to the British, back to the Americans. And the story that I'm telling you is about a man called William Beaumont, who was a surgeon. One of the problems with telling stories is that we might be accused of hagiography. When we tell stories of these pioneers as though they are saints, but they were ordinary people like you and me. Of course, not like me. They did many greater things, but they lived lives that were like the lives that ordinary humans lived. And James Boswell, who is the author of The Life of Samuel Johnson, says, "I cannot conceive a more perfect mode of writing any man's life than interweaving in it what he privately wrote and said and thought, by which mankind are enabled, as it were, to see him live." We are lucky that William Beaumont's life and works has been collected and collated by Jesse Meyer, who went and visited Beaumont's daughter when she was 90 years old. And when he went and visited her, she uncovered a couple of trunks in her attic which contained these precious letters and documents of William Beaumont. The event in question occurred in 1822, where a young man, a young fur trader, 19 years old, Alexis St. Martin, comes to the trading post, goes to the store, and is examining the guns on display there. Unknown to him, there is a gun which is already loaded. He picks it up, and as he picks it up, the gun discharges, and he receives a wound in his abdomen and in his lower chest. The people immediately rush for the surgeon in the fort, who is William Beaumont. He comes immediately. He looks at this boy bleeding there. He can see the destruction that the wound has caused, and he realizes that in all probability, it is only a matter of a day or two before the boy dies. But he picks him up and takes him to the hospital, which is depicted here in the fort. And in this hospital, he dresses the wound, he cares for him, and this boy is initially sustained by contributions from the people in the fort, but they run out of money. And then William Beaumont takes it on himself to take care of the boy himself, and he even takes him to his home. And this boy, Alexis St. Martin, makes a complete recovery, so that 1 year later, although he still has this aperture in his abdomen through which you can see his stomach, the lining of his stomach, he is able to begin to walk around. This is William Beaumont, and these are the descriptions of the wound that this young man, Alexis St. Martin, received. 3 years later, William Beaumont asks Alexis St. Martin whether he will participate in a series of experiments. The nature of gastric secretion and of digestion was not known at that time. Well, there was limited knowledge, and at that time, experiments tended to ask people to swallow something attached to a string and then to pull it out. These were things which were difficult to do. Well, in 1825, 3 years after the incident, William Beaumont performs his first experiment. And he says that through the orifice, he gently inserts a piece of food into the stomach, and then he waits for the stomach to do its thing. This was one of many series of experiments that he does. Alexis St. Martin stays with him initially, and then he goes away to Canada, he gets married, he has children, he returns, he goes away, and this start and stop of experiments, it results in a whole series of experiments which William Beaumont conducts. And essentially what he's doing all the time is placing food and withdrawing it at regular intervals and seeing how much of the food remains on the string, a process that he calls chymification. At some stage, he introduces a microscope into his investigations, but finds that the microscope doesn't reveal very much. And then he later on decides to actually insert a thermometer and look at the temperature in the stomach. Because Alexis St. Martin comes and goes, their relationship, as you can imagine, is a very intense one. On the one hand, Alexis St. Martin owes his life to William Beaumont. On the other hand, there is this doctor-patient relationship. And the question could be asked, does Beaumont exploit this relationship? It's interesting to note that Beaumont actually draws up at some stage, not the first time, but subsequently, a contract with Alexis, where Alexis is asked to abide, to travel with Beaumont, and that Beaumont in turn will look after him, provide him with all the amenities he needs for life, and that he will finally pay him a sum of money initially, a smaller amount, and on completion of the experiments, a larger amount. And at the end of this whole process, William Beaumont summarizes his results. And I don't know whether you can see on the slide that I've put this table by the side, but all you see is this table with a lot of foods and the time at which this digestion or chymification has occurred. William Beaumont does not write with any hubris. He states the facts as they are. And so he says, I submit a body of facts which cannot be invalidated, because that's exactly what he saw. My opinions may be doubted, denied, approved, according as they conflict or agree with the opinions of each individual who may read them, but their worth will be best determined by the foundation on which they rest, the incontrovertible facts. He publishes this in a treatise called Experiments and Observations on the Gastric Juice. He is aware that as a surgeon in a remote fort, there is not much more that he can do. And he desperately yearns to examine the gastric juice chemically. But till the writing of this treatise, he's unable to do this. He sent samples to Professor Berzelius, who's a Swedish chemist and one of the pioneers of modern chemistry, but receives no reply. And so he goes on to publish this. William Osler describes Beaumont as the first physiologist in the Americas. And I think in many ways this is a true pioneer, because America was really at the in the backwaters of medicine. The schools in Europe, the French school, the German schools, well, those were the schools which people went to study in because they were so methodical. They developed all the techniques and documentation of disease. Although at that time there was still one big gap, and that was while diseases were being described, the treatment of disease was still a long way off. And so, I mean, that was a lacuna that physicians felt. And William Osler, in his introduction to that book I showed you earlier on William Beaumont, Life and Letters, writes this in his introduction: the highest praise that we can give are expressed in Beaumont's own sentence. Truth, like beauty, is when unadorned the most. And in prosecuting these experiments and inquiries, I believe I have been guided by its light. Let us cross the Atlantic once again back to Europe, to a small provincial town in Eberswald, about 45 kilometers northeast of Berlin. Röntgen has described his X-rays. This is a famous picture of his wife's hand with a ring. And 2 years later, people have realized how important the X-rays are in looking at bones, but how difficult it is to look at the soft tissues. And I was quite stunned to see this picture on the right, which is a chest film from a book called The Röntgen Rays in Medical Work, where the exposure time to X-rays was 20 minutes. In fact, many people would be affected by X-rays, many scientists, including Walter Cannon, because the ill effects of X-rays was not known at that time. There were attempts to look at X-rays in terms of the heart, but these were singularly unsuccessful. You can see in 1934 a book that is published, The Heart Visible, and this is an X-ray picture of the chest at that time. It is quite inadequate. And so we move on to our protagonist of this part of the talk, Werner Fossmann, who's a young doctor who goes to that hospital in Eberswalde and has done his doctoral thesis on something related to overfeeding healthy subjects with liver extracts. But that's not why he's known today. He's known today because while he was in the hospital, he approached his mentor and suggested to him that we might be able to better see the heart by injecting a dye into the heart. The only question was, how do we reach the heart? And so we know now from records that Werner Fossmann enlisted the help of a colleague, and with the help of the colleague, when everyone had gone home, he passes a catheter through the antecubital vein, and as his colleague pushes the catheter down 30 centimeters, he suddenly stops and says, "No, we cannot go on further. It is far too dangerous." So Werner Fossmann goes ahead anyway. He confides in his mentor. His mentor suggests, why don't you do the animal experimental work first? But Werner Fossmann is convinced that this is completely harmless. And so, enlisting the support of a nurse the second time, he goes when everyone is away and he pushes the catheter the full length of what he believes is the distance from the antecubital vein to the heart. And this is a famous picture where you can see the catheter all the way into the right atrium here. When he does this, he walks down to the X-ray room, takes these pictures, and then there is a complete furor in the hospital because people cannot believe he has done this, because the heart was something that was quite untouchable. People didn't know how to deal with the heart. Cardiac surgery would develop eventually, but there was still the issue of the beating heart. And when he publishes this paper, he's very disillusioned by the response. He can see the enormous promise that it might provide, but as history will record, he gives up his investigation of the heart and he becomes a urologist. But he publishes this paper in 1929, and before he moves on to other things, he's a doctor in the Second World War. He is captured on the Western Front. When the war ends, he's released, and then he continues to work with his wife, who's also a doctor. While looking at this whole process, I came across this article which was published, which talks about the visualization of the chambers of the heart, but also importantly, the great blood vessels in man. And at the lower end of this article, where I've circled, I was surprised to see this name of Igaz Moniz. Now, I'm not sure whether all of you all are familiar with Igaz Moniz, but he is a man who was a neurosurgeon, although he didn't perform the surgery because he had problems with his joints. He's better known for his work on psychosurgery, or the initial experiments which in America were referred to as lobotomy. This was a time when there was hardly any treatment for mental health disorders. And when Igaz Moniz describes this lobotomy, it is greeted with quite a lot of enthusiasm because the initial response appears to be quite good. In time, it will fall out of disfavor and out of favor, and people will even begin to question whether Igaz Moniz should have been given the Nobel Prize, which he received fairly rapidly. But what I didn't know, and many of you all might have known, is that Igaz Moniz also investigated the blood vessels of the brain. And you can see here 3 photographs. Right on the top is where he works with dyes, which he injects into blood vessels to uncover the cerebral circulation, in a cadaver, in a dog, and finally, after a lot of failures and working with multiple contrast dyes, in a patient with a pituitary tumor. But as I said, he is better known for his work in psychosurgery. But many people would argue that this work of Igaz Moniz, in any case, validates his Nobel Prize. Fossman, for his that audacious experiment and self-experimentation, was awarded the Nobel Prize for Physiology or Medicine in 1956, and he is pictured here with his family. I always find this remarkable, and I'll tell you why. Because much of the work that Nobel laureates have done are usually a whole body of work done over a period of time. And Fossman gets the Nobel Prize for almost a singular event, but a remarkable event nevertheless. And so he is awarded the Nobel Prize not alone, but together with Richards and Conard, who use the cardiac catheterization technique to later on investigate cardiovascular physiology. And theirs is truly a body of work. And if you read the Nobel lectures of these 3 people, they are such a study in contrast. Fossman's lecture is a lecture about the historical evolution of the heart, and his role hardly features in it, whereas Conard and Richards have a lot of their own body of work, which they describe in great detail. I'm now going to go to another pioneer, and this is a person who spans both sides of the Atlantic, but her life begins in Europe. This is a period when Europe is recovering from the First World War and when fascism rears its ugly head. In 1922, Benito Mussolini seizes power, and then following the route that Adolf Hitler has followed in Germany, Benito Mussolini then begins to promulgate a series of racial laws, primarily targeting Italian Jews. Initially, the Italian Jews are not subjected to any violence or any real discrimination, but the laws exist. And then in 1939, Mussolini enters into this pact of steel between Germany and Italy, formalizing the Rome and Berlin axis. The person I want to talk about at this stage is a woman, and she describes her life in terms of 3 problems that she had. Problems because they were not problems in any real sense of the word, but they were really disadvantages. She was a woman at a time when women weren't readily accepted in the field of medical science. She was a scientist, which was almost unheard of for women, and she was a Jew. She was Rita Levi Montalcini, the daughter of these 2 people, Adam and Adele Montalcini. She here pictured with her 2 older siblings. While they were Jewish, her father was a very liberal freethinker, as he called himself. And although he brought up his children to be freethinkers as well, it did not matter what they professed. They were identified as Jews, and therefore they would pay the penalty for that. In 1938, when Mussolini passed these laws against Italian Jews, Rita and her sister, twin sister, Paola, were now grown women. Rita was a medical doctor, but was also interested in embryology. And once Mussolini passed these laws, she moved to Belgium, but then Hitler was threatening the western borders of Germany, and the low-lying countries of Europe were particularly vulnerable. And so she returns to Italy, where she feels safer. She talks about the issue of being a woman. And she says that one of the problems that she had was that she possessed two X chromosomes. This constituted an almost insurmountable barrier. And so when she describes, in her own words, how she went about doing medicine, she talks about her fear. And while she told her mother she was reluctant to talk about it to her father, she was finally pushed to talk to him about it. She was very clear. She told him, since I had no vocation for married life or for having babies, I would like to go back studying. And he asks her, what do you want to be? I was convinced that the profession I wanted to follow was that of medical doctor. He objected that it was a long and difficult course of study, unsuitable for a woman. I assured him that I was not afraid of that. Having graduated, one of the people that she was inspired by was this man called Santiago Ramon y Cajal. He's best known for his work with Golgi, where they developed the staining techniques for nerve cells. And this is done by Santiago Cajal in the rather sleepy academic center of Valencia in Spain, not a major academic center in Europe. But his work greatly influences Rita Levi-Montalcini. And when Italy's racial laws prevent her from being in university because Jews cannot be in university, she goes to her house and then she starts treating the other Jews, because she becomes a physician to other Jews because they feel more secure with Jewish doctors. But again, she runs into a roadblock because she can diagnose, but Mussolini's laws do not allow her to prescribe medicines. And while she is in these moments of despair, one of her friends tells her, remember Ramon Cajal? He did what he could do in a sleepy town of Valencia. Why don't you set up a laboratory and pursue your own interests? And so, during the duration of the war, she sets up a small laboratory in her bedroom since she cannot go to a university. She gets a microscope. With a scalpel, she begins to take sections. She works on the chick embryo. And she begins to look at the neural formations that occur as the embryo develops. She is also inspired by this man and a hamburger who's also a Jew. And she uses some of his methods in what she is pursuing. When the war ends, she has spent 6 years constructively exploring the chick embryo, and Hamburger invites her to the United States, and so she crosses the Atlantic to now a United States very different from the times of William Beaumont, because it is beginning to develop into a scientific powerhouse. At the University of Washington, she continues to pursue her work, and there is another investigator brought in, Stanley Cohen, who is pictured here on the right. And this is a truly remarkable partnership. She is a neuroembryologist, he is a chemist. And together, excuse me, they discover the nerve growth factor. But what is also remarkable in their relationship is this the statement by Stanley Cohen. He says, you and I are good, but together we are wonderful. And I really think this is a remarkable statement of collegiality, because in the history of medicine, we do not always see this. Take, for instance, Ronald Ross, who discovered the the role of mosquitoes in malaria, well, he was not willing to give credit in his Nobel acceptance speech to his mentor, who had actually taken him through the entire process of his experiments. The discovery of insulin saw Banting and MacLeod in a very bitter dispute over who should have been credited with the discovery of insulin. And so this collegiality is truly remarkable. As part of her experiment, she injected 3-day check embryos with mouse sarcoma cells. And then as she does this, and I find this almost poetic in the way that she writes it, she says the mass of tumoral cells, which differed from those of the embryos in being larger and more intense yellow, and in having a different growth pattern, were from all sides penetrated by bundles of brown blackish nerve fibers. These fiber bundles passed between the cells like rivulets of water flowing steadily over a bed of stones. Of course, she was describing the nerves, and she had this feeling that she was onto something truly remarkable, which she was. In her writing, she talks about Stanley Cohen, the man with whom she worked so much. She says he would arrive in the morning with a pipe in his mouth, limping slightly because he had polio as a child. And after traveling a short distance that separated his prefabricated cottage from where they worked, he was followed by Smog, the sweetest and most mongrel dog I ever saw. Smog used to lie down at Stan's feet when he sat at his desk and kept a loving eye on him, or slept while he fidgeted with test tubes or relaxed playing the flute. And when he finally left, because Stanley Cohen did leave, and then they both continued to be in contact with each other and pursue this, she writes, he set out with his limping step, smoking his pipe, Smog as always at his side. I followed them from the window while thinking back with gratitude on the years spent together and looking forward with anxiety to those I would have to face without his precious aid. He received the Nobel Prize in 1986. This is nearly 50 years after she started her investigation. And many people feel that the Nobel Committee really started becoming conservative, particularly after the backlash that they received over the award of the Nobel Prize to Igaz Moniz, who I described was the father of, in some ways, of psychosurgery. In talking about her life, she talks about chance. And I'll just read you the lower part of this. It is not only, as is so often stated, a matter of serendipity or of the perception of a truth that is there all the time but goes unnoticed until the mind of the observer suddenly grasps it, but rather of a fortuitous stumbling into a cave of precious stones while hiking up a tree on a trail that is not expected to bring one anywhere but to the top of the hill. Chance. Many people will look at the lives of pioneers and say, oh, this was all chance. But we are reminded, and I think this is a quote of Louis Pasteur, that chance favors the prepared mind. In writing her own autobiography, she writes, I have tried to reconcile two aspirations of the Irish poet William Butler Yeats, deemed to be irreconcilable: perfection of the life and perfection of the work. By so doing, and so in accordance with his predictions, I have achieved what might be termed imperfection of the life and of the work. The fact that the activities that I've carried out in such imperfect ways have been and still are for me a source of inexhaustible joy leads me to believe that imperfection rather than perfection is more keeping with human nature. What a loss if we were to distill down pioneers merely by the discoveries, as I have indicated in this slide. Because their lives are much more. They have much more to offer. Circumstances, context, yes, even chance. I see in their lives humility, hubris, and even humiliation. I see them plow lonely furrows for others, even generations later, to reap their rewards. I see them making leaps of faith, sometimes plummeting to the dark depths of failure. And then I see them confronting adversity and overcoming challenges against all odds. I see them exemplify the highs of human endeavor and the lows of human frailty and insecurity. And in many ways, once removed from their pedestals, their stories are essentially human stories, as Rahul pointed out at the start of this lecture, with all the trials, tribulations, and tragedy that life entails. I thank you for your patience.
Thank you, sir. Thank you so much, sir, for the amazing lecture. It was extremely fascinating to see the lives of all these great men and women and everything they've done. It was truly enlightening. In fact, it reminded me of a quote by the poem The Psalm of Life by Henry Wadsworth Longfellow. The lives of great men all remind us that we can make our lives sublime and departing leave behind us footprints on the sands of time. These stories have shown to me at least qualities that are of crucial importance in a scientist, in a physician, in a medical student. For example, observation that was exemplified by Dr. Lennox and Dr. Bowman, their discoveries. Belief in one's ideas, the willingness to take small risks to show what one believes in. This is shown by Dr. Werner Fossman. And most importantly, perseverance in the face of adversity, as was shown by Dr. Rita Levi Montalcini, along, of course, with teamwork. For example, the quote by, sorry, for example, the quote by Dr. Cohn that you and I are good together, but together we are wonderful is something which is delightful to learn about. So, once again, thank you so much for coming here and taking
Thank
this
you very much for
absolutely
having
wonderful
me.
lecture. And of course, I'd like to thank everybody who's helped us set up this lecture, Dr. Sunil Pandya sir, Lopa Mehta ma'am for all their guidance, and of course to you, the audience, for joining us today and attending this lecture. If anyone has any questions, could you please put them down in the chat box below so we can discuss them, or any comments or anything you'd like to say? We have some great comments here. Um, Ms. Amrita Vijayan saying she's in love with this lecture, sir. And yeah, Pranay Sinha saying it was a wonderful lecture. Thank you so much for
Thank you.
attending.
I must apologize. I didn't realize my video was off the whole time. I only realized right at the end. So I do apologize for that.
So thank you very much for coming, everybody. I think we'll end the meeting here. We'll see you again next week when we'll be having our lecture on war and medicine by Dr. Bharat Kelkar. We hope to see you all then.
Thank you. Thank you very
Thank you.
much.